We're going to talk about the role of technology in decolonizing your healthcare. But first, my name is Dr. Erica Steele. I'm a board-certified naturopathic doctor. I hold 6 degrees in my field. They're all in the natural healthcare space. And I like to say that I went to school so you don't have to. All this month, we will have a webinar, completely free, instant access. There is a link below. Click it and you can join all about decolonizing your healthcare. It goes over the history, goes over, what the current policies are, and goes over what you can do actively in your community, but more importantly with your health, because it really begins with self. I cannot stress that enough. So today's video is all about how technology really can play a pivotal role in you decolonizing your healthcare practice. So let's dive in. So first off, let's talk about the role of data. Data is so important, and data, it's almost like health access, right? And so who has access to your specific data, right? So who has access to your medical records, who has access to your lab results, etc. Some of these can be on centralized systems, but a lot of times they're on very separate systems. So you'll have maybe one healthcare data in one healthcare system, and then maybe healthcare data in other healthcare systems. It's important that, number one, you be the proprietor of all of your healthcare data, meaning you get copies of everything. This is going to help you in the end, because you never know what people write in your healthcare record, and so you want to be able to challenge it in real life. People don't realize that your healthcare record is actually a legal document. It can be requested at any period of time from insurance companies, law enforcement, any kind of people. And you want to make sure that the person that has written those medical records did so with good faith, right? And so we know in the healthcare system there are a lot of biases. And so if there are a lot of biases, naturally then they're going to then come out in the medical records. So definitely make sure that you educate yourself about that. I would also say building trust and accountability is important. Another crucial step is building trust in your data that you have. So for us, we take our own data, right? So we're not looking for, let's say, the CDC or NIH, or we're not waiting for those studies, because those studies take a long time. Instead, we're able to have our actual data. We use an app to do remote patient tracking. We can track blood pressure. We can track, heart rate. We can pretty much track any metrics, hundreds and thousands of metrics, from nutrients, and we keep that for you. And then obviously you have access to it in an educational platform. And this educational platform is able to educate you about your numbers, what they mean, and then what you can do practically. So you don't have to wait for all of these numbers to be carried back to whomever to then be analyzed. You can actually use your data. When I learned in school about the power of data and the power of knowing your data, I knew that I definitely could not be in the conventional system, because the data is not personalized and individualized. Instead, it's very generalized. So that is part of my solution, is really about in decolonizing it. It's about you leveraging technology. If you have an Apple Watch, for instance, you have tons of health data right at your fingertips, not even realizing all the health data you have, from your sleep to your respiration, breath rate, etc. Right? We combine that with other data marking points that we have, such as your labs, etc. And that's how we're able to really provide a very personalized plan. We've come a long way in testing, which has been really amazing and very, very exciting. And so, for instance, we have so many advanced tests that we can do. I can do an EKG, ECG completely remote and send that file over to a cardiologist when I'm referring. So really, technology has leveled the playing field. You really no longer have to, settle. I also would encourage you to look at telehealth providers. I know we like our face-to-face interactions, but a lot of holistic and natural providers are no longer wanting to be in those traditional practice models. Number one, they're very expensive to run. Number two, they're very stressful. Number three, they're just not sustainable to make it affordable. So it really becomes an issue of, volume, and it can be very exhausting and painstaking for a provider. Also, we have access issues in general with the weaponization of licensing and certifications and those types of things, systems systems, it has made it increasingly more difficult to gain access to holistic or natural or even traditional providers, because a lot of them are afraid of the government, quite honest, because they have been hurt, they have been injured, they have been threatened. Some even have lost, their livelihoods as a result to what is going on. And I'm not advocating for non-scrupulous activity. Naturally, we all have scope of practice, we all have legalities, we all have a public health responsibility. But I also think that there is a counter situation that's happening with our colonized healthcare system that does impact the rate at which we are able to access our information, interpret our information, and use our information practically. So I really want to provide people not only with their information, and really they're taking their information. I'm not providing the information to them. I'm merely providing them the education that they need with that information. So we really want to get out of this very imperialized, have and have not philosophy, because it really does not work in general. And if you looked at my other videos on this topic, the traditional herbal practices were really demonized, not because they didn't work, but mostly because they couldn't be controlled. So I cannot stress enough making sure that you do enroll in any of your digital EHRs with your provider, asking them if they have, digital platforms that you can have access to your medical records for years and years and years. I'd also encourage people to research and then also validate the research. So there's a lot of information being passed down, and it's not just, I heard a term that totally summarizes this well. Don't have cognitive laziness. If somebody says something and you are curious about it, please do your own due diligence in your own research. Also look at all different platforms. Not everything in PubMed is good, and not everything in PubMed is bad. Not everything on Google Scholar is good, and not everything on Google Scholar is bad. There are ways to vet quality information and also look globally too, outside of your region. Also, we use genetics and epigenetic testing now. With the advent of the Genome Project, we have a lot more data to be able to determine so much about you, from the diet pattern you should be eating, to supplements, to how you can prevent things. You're no longer a victim to your genes. You are 100% responsible for your health choices if you choose. And so you can use that data and then work on your epigenetics, which is the environment to which you put your genes in. So you have a genetic predisposition to something, you can either express it or not express it based off of your lifestyle. So making sure that you are more proactive instead of reactive, and also making sure that you are living more within your cultural means. That means you have to be able to personally identify with your ethnicity, your heritage, your background on a very deep level. And this fundamentally is what self-healing really is about. At the end of the day, all of these modalities in natural health care really are just designed to help you be more proactive instead of reactive with your health. So if you want to learn more about how you can be more empowered and you can decentralize your healthcare system, please watch our webinar below. It's 100% free. You just click it, boom, you're there. And if it compels you, definitely book a discovery call where we can unpack this for you and create a personalized plan that's gonna fit you and your needs, because we are all impacted by systemic racism in our healthcare system in so many different ways. And so we wanna create a very individualized approach for your healing process so that you can come together and so you can heal and transform, and you're not dependent upon a broken healthcare system that was not designed for you to begin with. So if you like my content, go ahead and like, share, subscribe for more.